So, I said that I would come on here and I would talk about my testosterone replacement therapy journey and basically what led me to TRT, what I'm doing with my TRT now, how it come about, the good, the bad, the ugly, the side effects, everything in between, and how I administer it as well. So, first things first, the way it came about. Now, starting from around 2022, when I was 22 years old, I started feeling like rubbish. Had severe lack of self-confidence, really high anxiety. I was going through a really stressful period in my life as well. And I also had even other symptoms such as lack of libido, all that sort of stuff. Got some blood tests done from the NHS and they said that I was fine, although I did think, looking at the blood test, my testosterone levels was quite low. But they assured me that I was fine and there was nothing wrong with me. No deficiencies in vitamins or anything like that either. So I just sort of carried on. I then carried on feeling like shit for maybe another 6 months, got another blood test, and my testosterone level was the only thing that had changed, and that had dropped again. NHS was still saying you're fine, so on and so forth, and this carried on for maybe a following 12 months, so another year of me feeling like rubbish. And eventually the last straw was I couldn't take it anymore, felt like absolute shit. Body composition was changing drastically for the worse, was losing muscle, putting on body fat, and I was eating and training the best I'd probably ever had been, solely to try and combat this feeling of why do I feel like rubbish, why am I starting to look like rubbish. Now, I had tried every single over-the-counter supplement, whether it's Fedoja, Agrestis, Tonka Ali, Ashwagandha, Shilajit, everything, even down to different diet approaches. I'd pretty much tried everything. So I was at the point now where I was clutching at straws and I didn't really know what else to do. I got another blood test and I sent it off to a private blood lab. They then told me that the reasons I was feeling the way I was feeling is because of my testosterone level. And initially I said, well, the NHS said that I was fine. And they said they will, because their spectrum of what they measure where your testosterone should be is ranging from males that are 18 all the way up to 75 years old. So in theory, my testosterone level was fine if I was, I don't know, over the age of 65. But for someone who was then 23 at the time, my testosterone levels were on the floor. They should be at their peak around that age. So this is where I was starting to worry of what the sort of next steps would have been. So in my head, I've sort of tried everything already without going on to sort of a harsher approach. I told them that I tried all the over-the-counter supplements, and they said, well, then testosterone replacement is probably going to be your best bet. They referred me to a clinic. Or they said basically go and find a clinic, there's loads of them about that will aid in testosterone therapy, testosterone replacement therapy, but they were so expensive. So we're talking, I think the clinic I looked at was in Harley Street. There's a few based all over the UK, and they are, I think the cheapest was £300 a month and the most expensive was around £700. So that'd include your testosterone, your pins, and obviously your swabs and your blood tests and stuff like that. So I deliberated for a little while and decided to give my coach a call, someone who I trust greatly with his knowledge, his experience with utilising exogenous testosterone and so on and so forth. And amongst us, we devised a plan of basically how to get my testosterone levels to where they need to be naturally. So now they sit at the peak end of my natural testosterone level, if that makes sense. Okay, so TRT, for a bit of background, is utilising exogenous testosterone to put your testosterone levels naturally where they need to be. So I sit way within superphysiological range. I'm not above superphysiological range. I'm in my natural range. Okay, exogenous testosterone looks like this. So this is, when it focuses, testosterone enanthate, 300 milligrams per milliliter. Okay, this cost me around £35, and this would probably last me around 20 weeks. So that is what I'm using at the moment. These are my pins. tiny little insulin pins, 0.5 ml per needle, and I'll show you how much I use. It is literally this much here. It's a tiny amount and it's not going to focus. Okay, so I'll cover administration as well, and basically what I'm doing to do it safely, and then I'll cover the side effects, the good things that I've noticed, and whether it's going to be right for you. So with administration, I always tend to get a little ramekin of warm water, and I will place my testosterone in the warm water just to heat up. It allows it to draw into the needle easier, and I find that it doesn't cause me any pips or painful injection points. So whilst that's warming up, I will talk about what I've noticed so far. So I'm about 22 weeks in. Okay, and now for me, utilising testosterone replacement therapy has completely changed my life. This isn't to say that it's going to do the same for you. It doesn't come without risks, but I was at the point where the reward completely outweighed the risk for me at this point. So this is where we are now. My testosterone levels are back where they need to be. My other hormones are much more balanced as well now. So it'd be like estradiol, and mine's gone blank. SHBG is in a better place, and so is obviously free testosterone and total testosterone. Okay, so they are better. They are where they need to be. I now sleep better. My skin is better. My performance in the gym is better. I have body recomped, although at the minute in a bit of a gaining phase, so a little bit fluffy. But ultimately, everything has improved. Libido is back where it needs to be. I'm not embarrassed about talking about it, so if anyone wants to DM me, they're nervous about sort of consulting someone, my DMs are always open. I'll be able to sort of help you or guide you in the right direction. But there is side effects. So you can have side effects. You can have painful injection points. That means you'll get a little bump under your shoulder. That's where I inject. Some people go into their glutes, some people go into their thighs. I know some people go into their chest, but I wouldn't recommend it. So there is the physical side effects that you can get from it. You can also get some mental side effects. Some people, it may enhance how they're feeling prior. It might enhance your anxiety if you're an anxious person and stuff like that. But for me, it simply just gave me my mojo back, allowed me to feel like a man again. So it was a no-brainer. The sort of further side effects can be that it can affect fertility a little bit, but you can get it back. A lot of people say you can't. There's probably 1% of people that say you can't get it back, but it will shut down your natural production of testosterone whilst you're utilising it. There is options you can take, like the HCG route, which will sort of essentially kickstart your pituitary gland into signaling to the testes to make more sperm production, and so on and so forth. But for the moment, that's not within my goals. Don't need to do that at the minute. When it comes to that time, that is something that I'll look into, or I'll simply just come off TRT to allow my natural fertility to come back. Is this warm now? Yeah, so this is warm. I'm going to cut this video and then I'll basically film the next bit in a separate section. So now this is drawn up, and I always keep the needle supported on the palm of my hand whilst I'm holding it, just because these needles are quite thin, they can bend and so on and so forth. So I overdraw, right, not that you're going to be able to see. I'll see if I can get it a little bit closer. So I overdraw, and then I go all the way back up, squeeze any air out to, I need to be able to look and see this, to 13 mil, 0.13 of a mil, sorry. So that looks literally like that. That's how much that we're talking. Tiny little amount. Okay, so then you pull your arm down and you want to be hitting the muscle. So it's an intramuscular injection. So I tend to go 2 fingers down from the bone, and where this fingertip lies is where I tend to inject. Okay, so what you do, find the point that you want to inject at, go in at a 90-degree angle, relax the shoulder, right, go straight in, and literally you're just going to push the testosterone in slowly. So I do this Monday, Wednesday, Friday. Now once you've released that testosterone in, you keep your finger on the needle and just pull out, and you'll give it a little rub. Okay, you might get a little bit of bleeding, a little spot of blood, it's nothing to worry about. Okay, we then take our other sterilisation swab and just give it a little rub over the area to prevent any infection, and that will stop bleeding pretty much straight away. So that is how I administer it. Obviously make sure that you put the cap back on your needle, don't poke yourself in the finger like I have a few times, and then dispose of it in a sharps bin. So that is the main bulkhead of it, sort of done and dusted with. What I want to cover as well quickly is the stigma that is attached to it. So I still get people saying, oh, you're a roidhead, you're this, you're that, you're the other. I'm not. This is a treatment. Like I say, it's not for everyone. I wouldn't recommend you even go on it without consulting a professional or getting your blood work done. Okay. I always find that it's beneficial to send your blood off to a private lab. I think it costs about £20 for them to have a look at it for you and basically give you a write-up. If anyone wants the link for the lab or anything like that, just drop me a DM or over on my Instagram or whatever, and I can definitely send that over to you. They're a trusted lab, they're well accredited. The people that work in the lab as well have got heaps of experience. So to have someone that is specialises in biochemistry, they are going to be much more beneficial to you. They'll tell you how it is. If you don't need testosterone replacement therapy, they will tell you that you don't need it. For me, it was a last resort, and it doesn't come without risks. Okay, so they are the main things to notice, or to note, should I say. But other than that, there's not really too much else to cover. Everyone's dosage will be different. Don't listen to what the biggest guy in the gym tells you, because he's probably chatting shit. Get consulted with a professional, let them work it out for you, and then depending on whether you want to go through a sort of more underground lab approach or you want to utilise a company like Harley Street, someone that's in Harley Street, should I say, that is completely your choice. But just make sure you do it safely. If you notice bad side effects, stop straight away, and don't abuse it. A lot of people find it easier or very easy to become addicted. Not addicted, should I say, that's a wrong word, but they will enjoy how it makes them feel, and instantly they assume that they want more. Now, too much of a good thing is a bad thing. Be level-headed with it. Use it to get you to where you need to be in terms of a natural level. And then also, what I want to differentiate is the difference between a steroid cycle and a TRT cycle. So utilization of steroids would be a much, much higher dose of this, okay? And testosterone and anaphase is just one steroid, it's a hormone, amongst a million. You've got Trenbolone, you've got your orals like Anavar, Winstrol, you name it. So there's a lot of different cycles. Just because someone's telling you they're on TRT doesn't mean that they are utilizing or abusing steroids. They could be doing it for a treatment. You can get it through the NHS, but the likelihood of that is beyond nil. A lot of the time they'll give you creams to rub on your nuts as well. And from what I've heard, they do not work as well as something like this. They will still shut down your natural production of testosterone if you're using creams. You're better off doing it in a nice, clean, safest way possible, and so on and so forth. So if you're having any doubts about your testosterone levels, if you're struggling, if you need more information, you want to talk to me a bit more in depth about it, my DMs are always open. Current clients, people that are inquiring, absolutely anyone. If there's anything you want to know in regards to TRT or cycles or anything like that, you can drop me a message. If there's something that I don't feel like I could help you out with, I will send you on to the right people who most definitely can. But other than that, hope you've all had a fantastic week. Enjoy the rest of your day and go out and smash it. Big love.